Hot flashes, irritability, weight gain, all of them are symptoms of menopause caused by declining estrogen and progesterone levels. And for some women, hormone replacement therapy can help. That's tonight's Women's Doctor. There are various types of hormone replacement medications. We've got pills, patches, gels, sprays, and shots. Some women say experience side effects like nausea, dizziness, or headaches. But Mercy Medical Center Dr. Tangela Anderson Tull says many women are finding relief through its important patients know the risks.
I always talk to people about the risk because no one ever dies of hot flashes, but some of the risk with hormone replacement therapy can be life-threatening for some people. Most people, it's low enough doses that it's not a problem, but you can have heart attack, stroke, blood clots, breast cancer with giving someone back estrogen and progesterone.
Well, Dr. Anderson Tull says she gets a lot of questions also about bioidentical hormone replacement therapy.
You can do a cheek swab and compound a hormone that's supposed to match your body perfectly. So it's supposed to be giving you back exactly your level of estrogen. So how much you need is different from the next woman and how much she needs. You have to be followed very closely for it.
Dr. Anderson Tull says bioidentical hormone replacement therapy isn't something she's offering. It's not FDA approved at this point, though some providers do offer.